Let's go into the
Zoom?
Zoom room. Sorry, where we have Teri Francisco, who is with the LCSW, and also the NASW, the National Association of Social Workers. She's the Guam chapter president elect. So first of all, congratulations on that.
Congratulations.
Oh, thank you, Chris and Sabrina. Thank you for having me this morning.
No, we really wanted to get you on the show because, we had a conversation with Teresa Ariola last week from Guam Behavioral Health and Wellness Center. And she was talking about, we know there's people that are graduating at the University of Guam. And there's actually a meeting today with Lieutenant Governor and some people from the University of Guam to talk about where all these graduates going because they are experiencing a shortage in social workers, in counselors, psychiatrists, psychologists, and they're just not getting them to come over to the Guam Behavioral Health and Wellness Center, and there is a dire need across the government. And I'm wondering if you could kind of speak to that. Are we seeing a shortage, and why?
We consistently, and I can't really speak right for any of these specific organizations, but I do know that social work on average can graduate about 12 social work students each year, right, per cohort. I do know that last year most of the social workers were pulled for with public health for COVID response, right? So they were managing the COVID sites, doing COVID tracing, right? So they were kind of pulled directly into the COVID kind of community response, right? So I think that's where most of them went.
Can you tell us a little bit about how the important role social workers, play in, for example, this pandemic, and just in general?
Well, reflecting on this need for social workers in our community really reflects on the social ailments that we're experiencing, right? If we need more social workers, that means that we're having heightened, increased levels of community ailment, right? And that is family violence, child abuse, that's unemployment, homelessness, a lot of economic disparity, right? A lot of even medical needs, right? So you need social workers. We're a generalist practitioner profession, meaning that social workers work everywhere, right? And we're kind of like the missing link to facilitate different processes, to connect people to the needed resources that are required for them to take care of themselves and their families, right? We work on all different levels, right? So we work, we respond to crises, but we also work on a macro level as well, right? So we're really the only helping profession that within our code of ethics is advocacy, right? So social workers are able to kind of help navigate large systems, right? And help to create better policies for marginalized populations, right? So any organization can hire a social worker.
Yeah, you checked off every single item from family violence, child abuse. Child abuse especially really hits me and really gets me burning, considering the fact with what happened over at the Child Protective Services and the need to declare a emergency for that particular agency, and the need for the Department of Youth Affairs to step in, and having, being in your line of work and to hear what happened. And that's something that we hear from Melanie. She's been on the show. There's a backlog of cases. We need social workers again. I mean, how does that make you feel when you hear what happened over at CPS, that you had all those cases that just kind of just sat there in the hundreds?
Well, again, it really reflects our community, the state of our community, right? And of course, all of the social problems have been exacerbated because of COVID, right? So, um, people haven't been able to, a lot of our families are just not able to function for themselves, right? And the heightened stress level of individuals and families, of the providers of families, right, have led them to seek other means to deal with that stress, right? And to channel a lot of the emotional distress, right, in other ways that are harmful, that aren't exactly healthy, right? So collectively, it just reflects, the state of all of our community, right? And social workers, will really rise to the challenge, right? Social workers, since the beginning of the pandemic, have not um, we've still been working the front lines, right? A lot of the different sites, public health, DOC, a lot of those sites have been like hotspots, right? So even with consistent exposure, social workers are still going to work every day, right? And that's just kind of the trait of the profession, right? Of our professionals, right? Is to no matter what, to be able to try to continue to respond to those that we serve, right? And I also know that because we're so generalist, a lot of the social workers were shuffled to different agencies during the COVID response, right? So you can have a DOE social worker working at the quarantine site, right, trying to help people work on their hardship exemptions, right, and trying to help people work from being in quarantine to being safely reintegrated into the community, right? So, we haven't stopped working. We've been consistently exposed. We did even lose a social worker in the past year. We lost, his name was Ricky Mendiola, right?
So you guys lost Ricky. Was he over at DOC? He was one of the Guam.
Yes, he did. I believe he did get placed at DOC, but he was actually a psychiatric social worker with Guam Behavioral Health and Wellness Center, right? And unfortunately, he did contract COVID, and it was a really brutal battle at the end of his life. He suffered for 2 weeks, right, before he eventually succumbed to the virus, right? And so during our social work conference, we're going to offer a memorial for him at the end of it, right? But he's really the epitome of how social workers will sacrifice ourselves, right, when it comes to the service of our community, when it comes to the people that we're committed to.
Wow. Yeah, I don't think we had heard about Ricky, and we just had the Guam Behavioral Health and Wellness Center director on last week. So he was a psychiatric tech, a social worker assigned to the Department of Corrections during the COVID pandemic, and contracted COVID while doing work there, and subsequently passed away.
I can't confirm where he got it, right? He was a psychiatric social worker, right? He was one of our social workers, right? I can't confirm that he got it from DO.
Right, but he passed away while working on the front lines of the pandemic.
Yes, yeah. All the way up until he was in ICU, he was working, right? And that's just testament to how committed we are.
We do have a caller from
Lynn.
Lynn?
Yeah.
Lynn, who wanted to talk about the Child Protective Services issue. Yeah. Do you mind if we just bring her on real quick? Good morning.
Again, guys, 637-0094 is the number here on the Breeze if you want to call and chime in at any time. And so, Lynn, good morning. You're on the air.
Hi. So I'm just concerned because the pandemic should not be an excuse why you guys are backlogged. That's not an excuse. So it's like saying, okay, my mom or my dad hit me, so we'll just have to wait because the government agencies are backlogged. That's not an excuse. That should not be an excuse. COVID should not be an excuse, and this is not exceptional because these children lose hope each day that they're getting beaten up, whether it's physically, mentally, emotionally. That's not an excuse. And while someone walks into your office, and while you guys are just sitting down like a skeleton's crew, like nothing's going on, so I'm sorry, that's not an excuse. You guys need to do better, because where are we? We're in 2021 and 109. What is it to be exact? Please correct me on how many cases that you guys are backlogged.
I believe it's over 900.
Yeah.
Oh, over 900. That is ridiculous. Are we waiting for one of our children to get shot or get beaten to death because the government or whatever it is, your CPS agency is backlogged? That is not an excuse. That is a poor excuse. Maybe if it was your child, maybe you would feel differently about it.
Thank you, Lynn.
Thank you, Lynn.
Yeah, and just to be clear,
exactly,
Terry doesn't work for CPS.
Yeah, she does not. She is with the social
I'm
workers.
sorry. I'm sorry. I didn't mean to give you the heat, but
No,
someone
no,
needs
no.
to get the heat
Yeah,
for
we
it.
want to
Right.
we want to bring the heat on this issue.
Yeah.
You're right.
I think that's just as criminal
Yeah.
of setting aside and not doing anything about it. But then again, the governor did step in. She declared a state of emergency,
Yeah, 900
albeit
complaints later.
Yeah, albeit. Yeah.
Sorry.
I see. I'm sure, Terry, you can feel and sense the frustration, and not just from Lynn, but just people who are listening and who have seen the stories about what happened over at CPS, and at the same time still wondering what happened and why hasn't anyone been held accountable. So,
Yeah, I
that
mean-
just really irks me. And
It's
again,
sad.
yeah, it really is. All those children.
Lynn, thank you.
Yes. Oh, but can I ask about something? Has anything heard anything about the allegations about since I'm on the air, about those Dusatani nurses, and I wanted to reach out to the public health director. Were they removed for these allegations? Are they still working? Because here we are using the CARES Act fund, while they get to sleep at the hotel and party, while these hardworking people get to expose themselves to COVID.
Thanks, Lynn, for asking that. We are actually going to be following up on that. We did get some information that these nurses may have been moved to another government agency, possibly down at the Port Clinic.
yeah.
We are still trying to verify that. We will be having the speaker on, I believe. Will she come on this
Wednesday,
week?
yeah.
Okay, she'll be coming on this week, so we'll be following up with her on the status of that, because she did write to the director asking for a full report on it. And during the oversight hearing, they didn't really even talk about it, other than she's waiting for the director to submit his report. And it's been a while since that oversight hearing, and it's due for a follow-up to figure out how serious they are taking this.
I just want to say, though, Bria, sorry to interrupt, but I just want to say at the press conference Friday, I believe one of the nurses who was the subject of this complaint was given high praise by one of the panel there at the press conference. So I'm not even sure what is going on. The director said one thing, we hear another, so you're right, something that warrants another follow-up.
Yeah. That's still on our radar, and definitely you will see something coming out this week, whether they do nothing, which
They're probably going to do.
But
or something.
isn't it, correct me if I'm wrong, isn't it whenever there's an ongoing investigation, they're supposed to be put on administrative leave? Any government agency, right?
I don't know the process,
And
but
that's for, like,
typically,
GPD
yeah,
sometimes?
typically
Yeah,
they do that. Yes.
Oh, okay.
Yeah.
Okay. And then once again, I do apologize to the lady. I
Oh,
thought
no,
it was
yeah, don't worry about it.
CPS, but yes, for those of you that are listening and you work for CPS or any agency, that's really poor, and that's a sad excuse, because that should not be happening. 900 some.
Yeah.
That's ridiculous.
And then we had a comment. Someone said, "Oh, get CPS on the show." We've had them on a bunch of times since this developed, and even before this news broke. And then from what they had said was there was one person who was in charge of receiving the complaints, and I don't know why this person allowed him to stack up that much, but from what we know, I don't even think that person's with the department anymore. But God, you should have called somebody.
Right.
Lynn,
And
thanks for
they
paying
do.
attention, though.
They are short-staffed over at CPS, but
Yeah.
like you said, no excuse. I mean, if people can telework and they can pull other people from
Yeah.
different agencies,
Yeah.
and maybe it does require a specific type of training to deal with that. Like,
Well, it kind of sounds like they just were receiving a bunch of 900 complaints.
yeah, exactly.
Jesus.
Yeah.
They can't take that much training to vet through some of those. I mean, we're
Mm-hmm.
not talking about, therapy or one-to-one or anything like that. We're just talking about the administrative process of accepting and vetting these complaints. But you know what? You're right, Sabrina. To me, it is pretty criminal. You know what I mean? Especially when you think about, people are saying like, oh, the parents, what about the kids though?
Yeah.
You know what I mean? CPS is supposed to be there to protect the kids, and this is it's just a egregious failure on the part of this administration. Thank you, Lynn.
Thank you.
You stay safe.
Yeah, and call anytime.
Okay, thanks.
Bye. All right. Hey, Terry, sorry about that, but obviously people are very frustrated.
Yeah.
Mm.
And we know it's not your fault.
Yeah, totally not your fault.
Oh, yeah.
But do you know?
These are-
Do you know how many social workers are actually working over at CPS?
no, I don't.
Okay.
I don't have that number right now.
I can imagine though that the type of work, especially, and even for family violence and domestic violence, it's got to be very difficult to be inundated, because we know that the crimes are really high, right? With that particular
Right.
crime.
And the type of work as well,
Mhm.
right? The constant emotional distress, right? That you have to kind of respond to on a daily basis,
Yeah,
right?
but-
So
Let me ask you, Terry. So, as frontline social worker, how frustrating is it when you run into these kind of like roadblocks or speed bumps that you run into when you're dealing with the bureaucracy of government?
how frustrating is it? Oh, of course, you have to develop certain professional skills yourself, right? And that's when training is really important, in knowing how to manage, to go from, every day from pre-crisis to crisis back to returning home to your families at night, right? Having to deal with, you're working with very vulnerable populations. You're consistently exposed to different types of traumas yourself, right? And so it's not just burnout, it's also compassion fatigue, right? If you're not careful, kind of, that kind of emotional fatigue, right? That can be very harmful to our own mental and emotional well-being, right? So what do we need? We need, the flexibility in our work. We need more support, right? We need to be able to have, to come from leadership and administration that kind of breeds a climate of trust, right? And validates, our abilities to, and our competency when it comes to facilitating the needs of our clients, right? So that really helps, right? When we have those kinds of environments that we're able to work in, because it helps with our morale,
Yeah.
right? And our safety, our network of safety within the organization or the agency that allows us to be more emotionally resilient as we perform these duties, right?
Is there a high turnover rate in the social work field?
Yes. Mostly with the crisis agencies, right? So CPS, Guam Behavioral Health, right? The agencies where you're just required to respond to these very distressing types of situations, and you just become so overwhelmed, right, with the caseload,
So
the responsibility.
right. So having said that, then are there not programs to help these social workers decompress? What is that called when do they have counselors, I guess,
Right.
to help these social workers?
Social workers for the social workers, in other words.
There's some collaborations, right, between agencies to provide those services. Um, we don't, I don't believe that any of those agencies have clinical staff to respond to the social worker employee needs, which is something that we could develop, right, as we move forward. Um, the government of Guam does have like worksite wellness, but and we don't. Social workers become too engrossed within the work to even manage their own self-care a lot of times, right? And again, social workers will, you don't just, unconscious. You have to consciously become a part of this profession, meaning that you have to have a personality that becomes committed to service, right? So we're always going to put our clients first.
Right. Being a member, you're now the president, right, of the National Association of Social Workers here in Guam. Is that correct?
Incoming yes.
President. So
Have
you've
a
been
current president.
I'm sorry?
We do have a current president
Okay.
on the board.
Well, you're the incoming president, so you've been with the organization though for a while, right?
NASW.
Yes.
Within this capacity for a few months.
For a few months, but with the organization as a member.
Yes,
Right.
since I was a student.
Okay, and having said that, have you seen this call from the government saying we need help, we need social workers? Have they been aggressively working with your organization because of, for example, what happened at CPS, because of what's happening over at the Guam Behavioral Health and Wellness Center? Obviously, there's a need. If there's a meeting that's being held today with Guam Behavioral, with Lieutenant Governor, with officials from the University of Guam. So I would think that they had reached out to your group, putting out the call, like, we need you. We need social workers. Do you recall that transpiring?
Not to this extent as it is right now.
Okay. And you mentioned that there is a conference coming up, which this memorial will be held for Ricky. Can you tell us more details about that?
So our annual National Association of Social Workers Guam Chapter Conference will be held on March 25th and 26th. The theme of it this year is maintaining connections through changing environments. Social workers are essential, right? And so the 2-day conference is going to be conducted virtually. We'll really aim to be a debriefing and kind of a reflection as a social work community of the different social movements that have transformed our community and our society within the last year, right? And so, of course, the second day focuses on COVID-19 pandemic, but there is also the Black Lives movement, that was really took flight, right, last year. So the first day of the conference is going to focus on racism and disparity, and kind of how we've tried to make connections to that movement on Guam, right? So the first panel on the first day will be discussing the upcoming renegotiation of the Compact of Free Association, right? So we'll have representatives from the different Micronesian communities. And COFA itself is really a reflection of, these bigger, larger systemic treaties, systemic agreements, of which our community on Guam as a territory kind of has to absorb the impact, the social impact of, right? So that'll be on the first day. That's kind of the primary discussion on the first day. And then the second day on the 26th will be the COVID response, right? Yeah. And kind of discussing what we're discussing now, right? How can we kind of troubleshoot? What are the problems that social workers have faced? And what are we needing to move forward? Be a little bit more proactive.
Yeah. Well, Teri, we certainly thank you. How do people sign up for the conference?
So I did leave Jason. I believe he said he was going to put it on the
Okay.
Facebook comments.
Okay.
It's the registration link.
Okay.
But they can also email naswgu@gmail.com if they're interested in registering.
Do you know how many social workers we have on Guam?
Within the NASW, and you have to sign up for membership, right? So that's the only numbers that we have. So it's not fully accurate of the whole number of social workers on Guam, but registered at this time within our membership is about 300.
Are all 300 fully employed? All 300. You have to be.
Yes.
Yeah. Okay. All right.
Yeah, but
Well, we certainly thank you for you coming on and all the work that you social workers are doing. Unsung heroes. Thank you so much.
yes, thank you for having me this morning. Have a
Okay.
good day.
You too. Thanks, Terry.
Thanks, Terry. 8:48.